So I want to say just a few words about cardiac pathologies. Okay, let's talk about the neonatal pathologies. How about that? Okay, we're going to talk about congestive heart failure a little bit later when we get to cardiac output. So pathologies, it's just fun to talk about. So when heart develops, here's my black marker. Okay. When heart develops, here's the heart, right? Okay, so this. So left atrium, right atrium, ventricle, right ventricle. Okay, see that? So here's the aorta, here's the pulmonary trunk. Okay. During the fetal development of the heart, does a fetus respire? Not respire. Does the fetus breathe with the lungs? No, it has no access to like air, right? So there is basically no need in separating right and left side of the heart, because the role of two circuits, like you have umbilical artery and umbilical vein that gets oxygenated, deoxygenated blood back and forth, right? So like pulmonary circuit is not really functional. So there's a connection between the atria, okay? Just call them foramen ovale, okay? It's an opening. And as far as I remember, there's an opening between the ventricles, okay? And on top of that, look, there is a connection between the aorta and pulmonary trunk, which is called ductus arteriosus. Arterial duct, basically. So what you see here is that right and left side are connected. Does that make sense? So what are the problems that we can face? I'm going to put it like broadly: failure to close. Okay? Look what can happen here. One of the common pathologies in newborns is when foramen ovale, here, foramen ovale fails to close. So you have atrial septal defect. Does that make sense? Got it? Another possible ventricular septal defect. Okay, does that make sense so far? And patent ductus arteriosus. Do you know what the term patent means in this case? In anatomy, it means open. So it still exists here. Does that make sense? Now, from your knowledge of cardiac cycle, from your knowledge of the blood flow through the heart, what's going to happen in terms of oxygenation?
If that connection is still open,
Yeah.
your blood would be mixed.
Yeah. You're not going to have the separation of circuits, right? And oxygenated, deoxygenated blood will be mixed. So one of the common symptoms in those newborns, cyanosis. Cyanosis is bluish skin, which is sign of insufficient oxygenation of tissues. Does that make sense? Because blood is being mixed. Another, in particularly, as far as I remember, in the ventricular septal defect, remember systemic circuit has a higher pressure, right? So blood from systemic circuit will get into the pulmonary, will increase the pressure in the pulmonary, and that may lead to pulmonary hypertension. Now the good news is all of this is fixable. Basically, you do a cardiac surgery on a newborn. This is why neonatal cardiac surgeons are getting paid unbelievable amount of money. Does that make sense? Clear? I'm telling you, I'm not going to ask about tetralogical follow-up for one reason. I cannot remember to save my life what are 4 components. I believe it's ventricular septal defect, patent ductus arteriosus, pulmonary trunk stenosis, but I'm not entirely sure. So basically it's 4 abnormalities all together. Does that make sense? It's not my favorite though. My absolute favorite pathology, which is anatomically just stellar, and I have an image of it in the lecture notes. Just look at it, it's great. It's transposition of great arteries or great vessels. So look at this model. It's it is mind-boggling. Look at this model. So think of it this way. So let's say we look at blood flow through the heart, right? So deoxygenated blood goes into the right side from vena cava, and then right side pumps it into the pulmonary trunk. And this blood through the pulmonary trunk and pulmonary arteries reaches the lungs. Are you with me so far? It gets oxygenated in the lungs and gets returned to the left side through the pulmonary veins. And the left side pumps it into the aorta, it goes to the systemic circuit, delivers the oxygen and returns back through the vena cava. In the transposition of great vessels, pulmonary trunk is connected to the left ventricle, and the aorta is connected to the right ventricle. So now look what happens. Deoxygenated blood returns into the right side. Deoxygenated, right? I mean, I'm talking about a newborn, not a fetus, a newborn. So it gets into the right ventricle. Right ventricle pumps it into the aorta, and the blood goes back to the systemic circuit without passing through the lungs. And on the left side, it returns from the lungs and gets pumped into the pulmonary trunk and returns to the lungs. And that's it. There's no mixing. 2 circuits are completely isolated. This condition is incompatible with a postnatal life. It can be fixed, as far as I know, by the surgery, basically in utero, like on the fetus, which for me is just, I cannot fathom the amount of responsibility that a surgeon is burdened by.
So if they're born with this, then
They can't breathe.
Can't be fixed.
I don't know if they can be put on some kind of machine, huh?
Some type of bypass.
Yeah, I'm not familiar with those clinical techniques. I would imagine probably there are some. I don't remember the name. There are membrane oxygenation technique when blood is bypassed through the special machine. It gets oxygenated there outside of the lungs. It can be done. So possibly yes, but it's insane, just insane.
Can they get the surgery after they're born, or it has to be?
As far as I know, most of them get surgery before they're born, which is, again, when we say born, at this point, nobody's talking about natural birth, obviously. But it's just, for me, it's insane, the level of skill that surgeons have to do that. It's just mind-boggling. And sort of, kind of on the boring side, aortic stenosis or atresia. So basically, the aorta here, is either massively narrowed down or just completely blocked, obstructed. Okay? Again, fixable, especially in stenosis, it's actually quite interesting. So in stenosis, usually, and this is also kind of cool, as far as I remember, aortic stenosis is observed mostly past the brachiocephalic trunk and left carotid and left subclavian arteries. So it's somewhere here. See that? So basically what happens, blood leaves the left ventricle, okay, goes into the aortic arch, and most of it freely gets to the upper body through the brachiocephalic trunk and left carotid, left subclavian, but it doesn't get to the lower part of the body. So people have hypertension in the upper part and cyanosis is in the lower part because there's an imbalanced blood supply. That makes sense? I think it's kind of cool, you know, it's developmental abnormalities.